Well, hello again. Now, one of the things that people who are in general practice and in general clinical practice around Europe and indeed the world want to know is what are the big issues in clinical care and clinical science at the moment in the diabetes world? And who better to address that for us than Leszek Czupryniak, who is at the Medical University of Warsaw. Hello, Leszek. How good to welcome you.
Yeah, hello, great to hear you and great to be part of this annual meeting, which is always the greatest festivity for the whole diabetes community.
So what are the big clinical questions of the moment?
Well, whether we like it or not, we will always evolve around pharmacotherapy, although in diabetes, non-pharmacological means are always very important and simply crucial. This is the foundation of any treatment. But saying this, we will still resort to the drugs, and also this is what the patients expect from us, getting a prescription for a drug which is easy to take, well tolerated, very effective, and which possibly would cure them from diabetes. We can't cure anyone with any drugs, but we are undergoing revolution in terms of type 2 diabetes treatment. And the revolution is kind of unexpected. It surprised both the producers of the drugs and scientific associations and clinicians alike, let alone the patients. And by saying this, I mean the role of SGLT2 inhibitors and GLP-1 receptor analogs, which seems to be doing much, much more than we expected or we thought originally. It's also the great lesson in being humble, because with SGLT2 inhibitors, we were really skeptical at the very beginning because the drugs cause glycosuria. And before the era of glucose meters, the presence or absence of glycosuria was, for us, it was the threshold of telling whether the patient is poorly or well controlled. But nowadays, these drugs have powerful cardioprotective effects, nephroprotective effects, and as it stands now, GLP-1 receptor analogs seem to be extremely effective in combating obesity. So any data presented at the ASD, and there were some data already presented today, showing that using these drugs, how effectively we can treat diabetes, how durable they are, how they defer insulin therapy in type 2 diabetes. Sometimes I dare say that if GLP-1 receptor analogs and SGLT2 inhibitors were invented before insulin was discovered, then we would really rarely resort to insulin to treat type 2 diabetes, simply because this is the drug which works well, excellently, but pathophysiologically is not justified in many type 2 diabetes patients who already take insulin. So any large meeting, and the ASD is the best one ever we are having, brings plethora of data on the usage of those new therapies. And as I said, 5 years ago, 6 years ago, we were pretty stagnant. Not much was going on here. We were discussing other issues, a lot about insulin. A few last years, the paradigm of treatment has changed, the debate has changed, and it really leaves us with making up the decisions every day, seeing new patients, the decisions which we feel are based on evidence, but are also challenging because the evidence keeps coming. We almost month by month have to follow the literature, new publications, and to follow also the changing indications for the drugs. Just to give you an example, like SGLT2 inhibitors, which have very dynamically changing the threshold of renal function, at how low renal function we can use these drugs. So I guess knowing that over 80% of ASD participants are healthcare professionals, practitioners, clinicians, I guess these sessions which will present new data on pharmacotherapy will be the best attended. And they also change our practice. And That's another value of EASD meeting, that whatever is presented here, we take it up and then we translate it almost immediately into our daily practice, especially that the most important studies are concomitantly presented as papers, usually in the most respected journals. So that's what me and my other colleagues are mostly looking at, I guess.
So that's largely type 2, but of course we've got the very important consensus statement on type 1. What will that mean for clinicians?
Yeah, that's the great news. This joint statement, the EASD joint statement on hyperglycemia management, on type 2 diabetes management, has really changed the way we treat diabetes, the way we think about treating diabetes, and all local and national, but also other international guidelines rely heavily on the document published by ADA and EASD in the last edition 3 years ago. Type 1 diabetes, unfortunately, has, I would say, has not been more often at EASD meetings. We always discussed it, but not as much as type 2, which is a pity because that's the mother of all diabetes, I would say. That's the model disease, and it's also the fatal disease unless it is treated with insulin properly. So this joint statement is, one, great acknowledgement of type 1 diabetes treatment, the importance of type 1 in general in human health, but it also it will help to solve other clinical dilemmas we are having. And knowing how successful was the joint statement on type 2, I have no doubts that also for type 1, this statement will simply lay the foundation of our common clinical thinking. So I would see it like twofold. First, of course, all the merits and evidence and guidelines. But secondly, it also shows that EASD is also a type 1 diabetes association, not just type 2, as it sometimes has been claimed in the past.
So just finally, in the couple of minutes that we've got left, just give me the Czupryniak wild card. What is coming up on the clinical science agenda at EASD that you are particularly interested in or that you think will have a big impact for clinicians?
I guess any data showing concomitant use, combination use of newer therapies will be, again, a milestone in type 2 diabetes treatment. So how effectively and how early we should introduce the concomitant use of SGLT2 inhibitors and GLP-1 receptor agonists administered once weekly. And the next great step is, and I guess we will be hearing more about it in next year's EASD meeting, is a one-year insulin, 1 year insulin, still a dream, but once weekly given insulin preparations. With GLP-1 receptor analogs, there is another thing. We've just, this year, we've seen the oral preparation of GLP-1 receptor analog arrive. And that also gives hope that if a peptide like GLP-1 could be put into a pill and can be swallowed and used as an effective treatment, perhaps also insulin could be put in a pill and used as an effective oral treatment as well. That will be more than warmly welcomed by many patients. So that is something we are, I would say, the recent developments really whet our appetite. And what we've seen in the last 5-6 years, it only makes us want more. We have a saying in Polish that appetite rises in the course of a meal. So apparently this is what is actually happening on the clinical side of diabetes research.
And how appropriate it is that this is all happening in the centenary year of the discovery of insulin, a whole raft of new treatments, and it's wonderful to hear. So thank you so much, Professor Czupryniak.
Thank you very much for inviting me.
EASD TV.
Thank you.
Thank you so much. And that's all for the moment. There'll be more later.